Good afternoon, everybody. Welcome to another edition of Facebook Live here at Scottish Rite Hospital. So I'm here today with Lorena Floccari. Lorena is one of our current fellows, and we're going to talk about the fellowship, which is part of training for being an orthopedic surgeon. So first of all, welcome.
Thank
This
you.
is your first time here.
Yes.
We're live on Facebook, and all your friends and family will be able to see this as time goes on. So first off, why don't you tell us a little bit about yourself? So Lorena came to us, and she's here for the year, and so Lorena is incredibly well trained. And let me tell you a little bit about fellowship. So fellowship comes after 4 years of college, 4 years of medical school, and 5 years of residency, of orthopedic residency. And then folks decide that they want to do pediatric orthopedics, and then they seek out a fellowship. So tell us sort of where you're from and sort of a little bit of your training before you got here in Dallas.
So I'm originally from Akron, Ohio. I went from there to St. Louis University for undergraduate in college. I went from there to The Ohio State University for medical school. I graduated in 2012, and then I went and did 5 years of residency training at Mayo Clinic in Rochester, Minnesota. And so there I just did general training to be an orthopedic surgeon. And then from there, I decided that I wanted to subspecialize in pediatric orthopedic surgery. And so I landed here at Texas Scottish Rite for a one-year fellowship.
Great. So she's being modest. So in college, she was a Division I softball pitcher, correct?
Yes, correct.
And she tells me, how fast did you throw the softball?
About 60 miles per hour.
60 miles per hour. So I can't even throw that over him. So that's really impressive. And then she went to really great school and great residency at the Mayo Clinic. So how did you hear about Scottish Rite Hospital?
So several of my mentors at Mayo Clinic had trained here, and so they had just the best things to say about their experience here and how well they were trained starting out their careers. And so when I started talking with them about my interest in pediatric orthopedics, all of them said, come to Texas Scottish Rite Hospital and that's where you need to train. And so that kind of sparked my interest, and then I came down and interviewed, and I met all the staff here, and I just loved it. Like, as soon as I stepped foot here, I knew, like, this is where I wanted to land. And so, everything just kind of worked out, and here I am.
Yeah. So, and the interview process is a pretty rigorous process. So we have 5 pediatric orthopedic fellows. Lorena just happened to be free today, and for these 15 minutes, she's going to go back to clinic, and we'll tell you a little bit about the training, and you'll tell us a little bit about the training. But the interview process is pretty rigorous. We interview about 35 applicants for the 5 slots, and so they're very talented folks, and so Lorena was one of the folks that we really wanted, and so we were really happy she matched here. And there's a formal computer match we put in our list. The fellow applicants put in their list, and then there's sort of a match. And so we were really happy to have Lorena on the team. So, so folks out in the audience are going to wonder, well, how do fellows actually interact with us, the staff, and how they see patients and in the clinic and in the operating room and in the outpatient, in the inpatient setting? Can you give us a little bit of taste for how that works?
So we're on teams where we're paired up directly with all the surgeons here. And so over the course of the year, I'll have the opportunity to work with all of the surgeons here. And my job is to learn everything that they do, from the preoperative evaluation to seeing everybody in clinic, to doing the surgery, to taking care of patients after surgery, both in the hospital and in follow-up. So I really just want to be a sponge and soak up everything in the whole process. And so I'll generally, in clinic, I'll see patients before, and then I'll come up with my own ideas of what's going on and how to best treat them. And then I'll present my findings to the attending, and then we'll discuss it. And that's where a lot of the teaching happens, and we'll go through the x-rays and the clinical exam findings, and then we'll go in together, and then the attending will take another history and do another exam, and I'll be observing, and then come up with the treatment plan, and then we'll kind of discuss it afterwards too, what they found and what I had found, and And then in surgery, we are doing all of the cases one-on-one together. And so I am just learning every step of the surgery, from the planning to how to do everything, with just kind of a stepwise progression. But we're in there together the whole time, and it's just an amazing educational opportunity for me. And then the same thing for in the hospital. I'll see the patients every morning and round on them and do all the chart work, and then we'll discuss how the patients are doing, and then generally we go back and see the patients together.
Wow, so it sounds like a lot of responsibility.
It's a lot of responsibility,
Yeah.
but it's a lot of fun.
Yeah. So I think for parents and families out there, it's really important that you know that I think the fellowship really does several things for the fellows. It does several things for us. And ultimately, I think it really helps patients and families because these talented young folks come here. They know a lot. They're learning a lot, but they sort of keep us on our toes. They have an incredible interest in really doing a great job. They get unbelievable histories. They interact with the families. And oftentimes the children and the parents bond with them more than they bond with us, especially when they come to the hospital, because they see the kids every day, at least 2 or 3 times a day. So tell us how early you get here and round in on families in the morning.
I usually get in around 6 o'clock, and then I'll get up to the floor around 6:30 or so and see all the patients. And then I'll either be in clinic that day or in the operating room. And then I'll usually go up and see the patients again in the afternoon, and then before I leave again in the evening.
So we generally round together in the afternoon. We don't generally round first thing in the morning with the fellows. But at 7 o'clock, we have a conference every day. So they get here, they round, see patients at 6 o'clock, and then we have conference at 7, and then they get started either in the operating room or in clinic. So it's a really, it's a great collaborative effort. There's lots of interaction that happens. There's lots of questions that we ask them and they ask us, and it's really... in the end, I think it helps elevate the care of patients. So it's clinical care, it's education, and then another part that the fellows participate in, and that is research. And so I view research, and we view research as answering the unanswerable questions we have today to take us from where we are today to where we want to be tomorrow. And I think the fellows are really obligated to do at least one good research project. And this year's class has been amazing. They have at least 2 or 3 projects. And Lorena has been really productive this year in research. Why don't you tell us a little bit about what you've done?
So I'm working on one project with Dr. Sucato, and we're looking at if we can do, 2 scoliosis surgeries in one day as compared to doing 1 in the past. And we, so far, have shown that it's safe, effective, cost-effective. And so I think that as we move forward, it's probably going to be an increasing trend. And so we just wanted to show that it's a satisfactory way of treating. And then the other paper that I'm doing with Dr. Sucato is looking at a specific technique in surgery, a type of osteotomy, which is a technique that we can use in spine surgery. And we were just showing pros and cons for the use of that and how effective it is in treating the scoliosis.
Yeah, so that's a good summary. The 2-a-day sort of due to idiopathic scoliosis, which is our most common type of scoliosis. We select patients in which the curves are mild or moderate and making sure that it's safe. And so that's really what the study did. It demonstrated it's really safe, it's really efficient, and actually, in some regards, it's actually more efficient to do it. Each surgery is more efficient compared to doing it once a day, so 1 per day. So I think overall, we really try to demonstrate or try to improve the care that we're doing today so that we're better into the future. So research is really important. So let's talk about the fellowship just in general, and I'll give a little historical background. I think the fellowship was started by Dorothy Edwards, and it was funded by her through her generosity. The fellowship was really the brainchild of Tony Herring, who's still here at Scottish Rite Hospital, and It started 40 years ago, and the first fellow was actually in 1978. And we have over 200 fellows that we've trained. They're scattered throughout the United States. And it's been a really great thing for the institution. It's been great for families. So we get 5 fellows each year. And they come from all over the country. And so this year they came from the West Coast, the East Coast, North, South. Sometimes we get fellows from Canada. So that's sort of a little bit the history of the fellowship. We also train UT Southwestern residents, and so the residents, we have 4 residents a year, or each rotation, and so there's 3 from UT Southwestern, and then 1 from the triplet program, and so the fellows interact with the residents, and we interact with the residents, teach the residents. Also a very talented group of folks, and they come from UT Southwestern. Under the leadership of Dane Wukic, who's the chairman of the program, and been here for about a year. So let's. What are some of the? So that you gave us sort of the medical side of things. What are some of the fun things that perhaps Dallas or the fellowship has sort of presented to you?
Well, I've loved getting to know Dallas. It really is an incredible city, and I have been for 5 years in Minnesota, and so I'm especially enjoying being down here this winter. But just the food and the restaurants and all the culture and just social things going on in Dallas has been a lot of fun.
Do you have cowboy boots yet?
Not yet.
Not yet.
I'm working on it.
Okay.
But in terms of the fellowship, there have been activities from day one that have been with the intent of just fostering relationships on more of a non-professional but a personal level with all the attendings, and all of them have had us over to their houses, and we've had different events that have been really fun. Some of the hospital fundraisers we've had the chance to go to, and those have been a blast. But it has just been a great year, kind of from day one. We ran the marathon together on a team relay, which was a lot of fun. So
and that benefits the hospital. The Dallas Marathon benefits the hospital, so we're very grateful for that. And that was a fun event. Well, we enjoy the fellows quite a bit because they're all very talented, like Lorena. And like she said, we get to know them on a very professional level, but also a personal level, and sort of get to know them. And working one-on-one is really a special environment and a special way to sort of interact with really talented folks. And so it's been fun. And we do a lot of social events on the outside, and try to get to know each other and have a good time. So, anything else you'd like to add? Okay, what do you think distinguishes this fellowship sort of from maybe other fellowships that you interviewed at?
Well, I think the education is second to none. We have amazing conferences. One of our conferences happens every Monday, and we stay until past 7 o'clock at night, and we go through every single case that the institution is going to do for the week, all the surgical cases. And we have like all of these attendings and just some of the experts in the world discussing some of the controversial things or discussing what would be best for each patient. And that has been my favorite part of the fellowship. It has just been a tremendous learning experience. And I don't think you get that anywhere else. And so I think that has been one of the biggest things is just the education that has really set Texas Scottish Rite apart. And then also the variety of things that we see here. We see kids from all over with just a huge, vast array of pathology, and it's just, I can't imagine, just how much I've learned even halfway into my fellowship. So it's really been an incredible year so far.
And the Monday night conference starts at 4:30, and like you said, sometimes ends at 7:30. And as you said, we go over every surgery for the week, and so there's lots of different opinions and lots of different input from various staff, and even from the fellows and from the residents. And so that's really important, 2.5-hour conference. And then on Friday, we review everything that's been done and sort of critique, what could we have done a little bit differently, input from folks, and how we ought to move forward after the surgery. And so it's not just the surgery, it's how do you manage the patient afterwards. So it's really a collaborative team effort, and it's not just surgeons, it's also therapists are in the audience, radiologists are in the audience, so everybody can input, and it's a very free and open discussion of what's going to be done. So, Well, I think that covers pretty much the fellowship, and hopefully the audience got a good flavor for what the fellowship is about and how our fellows come from all over the country and work here at Scottish Rite Hospital. And I'd like to thank Lorena for taking time out of her busy schedule to come chat with us, and it's been a great session. So
well,
thanks a lot.
Thanks for having me.
See you all next week for